My name's Andy Pearl. I'm an orthopedic surgeon at Hospital for Special Surgery. Well, I think medicine for a long time was a little behind other segments of the society in terms of adopting technology. That has changed over the last decade, and I think that we're really entering a golden age of orthopedic surgery.
For example, in total knee replacement, the entire joint is removed, and the artificial knee doesn't move quite like a normal knee. Arthritis sometimes just affects a portion of the joint, and a partial knee replacement can be an excellent solution. However, it's a technically challenging procedure. For the past 5 years, I've used robotic assistance for partial knee replacement. I call this robotic knee resurfacing because the robot allows us to remove only the minimal amount of bone to resurface the joint. With this robotic-enabled technology,
we have the opportunity to look at a patient's actual anatomy, their actual knee, on a computer screen in 3D. We can move it around. Then we can take 3D implants, the actual size and dimensions of the implants that we're planning to place in the knee, and place it into the knee in all sorts of different positions. And we can use this tool to refine the implant position many, many times before we actually touch the patient's skin. It really makes this very difficult operation very reproducible, and it's having a wonderful impact on my patients and their lives.
this is what the robotic arm that we use in the OR looks like. At the end of the arm is a small burr that allows us to sculpt the bone. I have complete control over the robotic arm at all times. We get a CAT scan preoperatively, and from this CAT scan, I can make a 3D model of the patient's knee. On this model, I optimize the plan so that the implants are perfectly aligned and the minimum amount of bone is removed. In the OR, I can track normal knee motions on the computer screen before I ever touch the bone. I can then fine-tune my implant position, moving it in such a way so that I can recapitulate these normal knee motions. I feel this is one of the most exciting aspects of robotic knee resurfacing. This helps restore a more natural knee movement and a natural knee feel. Once the plan is finalized, the robotic arm allows me to sculpt the bone in a very precise way so that the plan is actualized. The burr allows us to remove just the amount of bone that we planned on the computer screen. The robot prevents me from drawing outside the lines, if you will, and removing excess bone. The implants are then cemented into place, and the operation is completed. This robotic knee resurfacing allows for rapid return to work and play, and is a wonderful alternative to more invasive treatments for knee arthritis.